We've always been told that getting a colonoscopy wasn't necessary until the age of 55. But colorectal cancer is not an older person's disease anymore, as it's been affecting younger American adults with greater frequency. About 20% of people with colon cancer in 2019 were under the age of 55, almost double the rate seen in 1995. And that's according to the American Cancer Society. Actor Chadwick Boseman, right there, is an example of that, as he lost his battle with colon cancer at the age of 43 back in 2020. He was just 39 years old when he was diagnosed. Such a sad story. Hi, everyone. I'm Olga Villaverdi, your host for today's discussion, coming to you live from the Baptist Health Newsroom. Now, although a colonoscopy continues to be the gold standard in detecting precancerous polyps, more tumors are being detected in advanced stages. Since March is Colorectal Awareness Month, we have with us two experts for the Baptist Health family to talk about the importance of colonoscopies and listening to your body. I'd like to welcome colorectal surgeon Dr. Jordan Moseson from Baptist Health. Happy to have you, Dr. Moseson.
Thank you. Pleasure to be here.
Pleasure to have you. And medical oncologist Dr. Sarah Joseph from Baptist Health Miami Cancer Institute. Welcome, Dr. Joseph.
Thank you, Olga. Thanks so much for having me.
Great to see you. Now, before we dive into today's subject, I want to remind our viewers to send in your questions and comments throughout the segment. We are here to answer your questions. All right. So, Dr. Moseson, I'm going to start with you. Let's start off with just basics. Medicine 101. What is a colonoscopy for those that have not gotten one? And I have many, and I have my experience, and I'm going to talk about it. And what is the purpose of this exam, doctor?
Okay, so a colonoscopy is a screening examination that we do to look for colon polyps, which are precancerous growths. And this is typically done with some anesthesia because it's an endoscopic examination, meaning we use a flexible camera to actually look inside the colon and try to detect these small polyps. And as you mentioned, it's the gold standard for screening. Meaning that all other exams have to measure up against the colonoscopy. And it's my personal preference because it's not only diagnostic, but can be therapeutic in that we can remove any polyps that we find at the time of an exam.
Dr. Joseph, let me bring you in. A new study from the American Cancer Society is showing an alarming trend, and I kind of mentioned it right off the top, that shows more young people are getting diagnosed with colorectal cancer. Is there a reason why younger people are receiving this diagnosis? Is it awareness? Is it because they're getting colonoscopies, or is there something in the food, in the water? What's going on?
So I think that's such an important, question, even with everyone that you mentioned, for example, in the news and celebrities actually getting diagnosed and passing away from this disease. So it brought a lot of attention. And a lot of the times the reasons for colorectal cancer can be multifactorial. So we have genetic causes, which are those that run in the family. And then we have changes in the environment and, for example, lifestyle changes. So when we kind of dive into the genetic reasons, an alarming 35% of young patients with hereditary colorectal cancer syndromes, for example, like Lynch syndrome, those are the ones that are associated with younger adults being diagnosed with colorectal cancer. So it's so important to know your family history when it comes to having a genetic mutation that will predispose you getting diagnosed with colorectal cancer at an earlier age. Now, if we look at a different avenue, we look at environmental or lifestyle changes, for example. They kind of looked at 20 different studies, and they looked at everything that you can possibly imagine to look for why is it that patients are getting colorectal cancer diagnosed early, in between mostly the ages of 40 to 45. So they kind of compiled four big things. First was family history. So if you have a first-degree relative diagnosed with colorectal cancer, that will change the screening for you, for example. Interestingly enough, obesity and hyperlipidemia, I think those kind of maybe go hand in hand, and alcohol consumption. So those four things, they concluded that were partly responsible for the increase that we've seen with earlier patients being diagnosed.
So let me ask you this as a follow-up. How do you know then, besides the family history, obesity, what are the signs? Is it sometimes maybe having a pain? How does someone know that, wait a minute, I could have that predisposition or I'm at risk?
Okay, so interestingly, 86% of patients that we diagnosed under the age of 50 actually are symptomatic. So what are these signs? A lot of the times you'll have either no symptoms from colorectal cancer and it's diagnosed on a screening colonoscopy, for example, Or if your first degree relative was diagnosed at age 50, then you want to get diagnosed 10 years earlier, for example, at age 40. But what if you're having this like vague abdominal pain? You don't know what's going on. You're kind of losing weight. When you're looking at your stool, you're seeing that it's really dark. There's a change in color. There's a change in the caliber of the stool. So for example, they become pencil thin. So all of those symptoms, for example, dark stools can mean that there's blood in your stools. The abdominal pain could be from the actual tumor that's sitting in the colon that's causing this pain. And if the tumor is obstructing in the colon, then it kind of changes the caliber of your stool. So then you'll see that you have a change in your bowel habits. So those generally tend to be the top symptoms and signs that we see with colorectal cancer. Or you go to your primary care physician and you're like, you do blood work and you come back completely normal, except you have iron deficiency anemia. So you have no symptoms whatsoever, but you have this blood test that you're anemic and you have no idea why. That's one of the signs to then go see your colorectal surgeon or your gastroenterologist and get a screening colonoscopy.
Great information. Okay, so Dr. Moseson, let's talk about this experience, shall we?
Sure.
I'll share mine if you share yours. How's that?
Well, personally, I haven't had a colonoscopy yet because I haven't reached the screening age. But I just wanted to add something to what Dr. Joseph said a little bit before about the signs and symptoms of colon cancer. All of the things that she mentioned, the blood in your stool, the abdominal pain, the change in bowel habits, those are all signs of a later stage, either larger polyp or an actual cancer. Most of the time when we're doing screening colonoscopies, people have no symptoms whatsoever. The polyps that we're looking for are sometimes millimeters in size, and they generally don't cause any symptoms at all, which is why it's so important, even if you're feeling well, if you're not having any of those symptoms, that you should still get that screening colonoscopy done when it's at an age-appropriate time. So let's talk about the experience, shall we?
Yes, because colonoscopies don't have the best reputation, right? So we all know it's a pain in the...
You know.
And it's a process. And I remember doing my first one. I was having some pain, no family history, but just in case I wanted to follow through. And it was quite an experience. So why don't you prepare our viewers for what to do?
Well, I like the word that you use, prepare, because as some of you may know, you have to do what's called the prep. Now, I tell patients that the colonoscopy itself is actually the easy part of the exam. That's my job. I have to do that part. But you actually get to take a nice little nap. The difficult part for most people is the day before. In order to prepare for this colonoscopy, we have to clean out the colon from all the stool and the material that's inside there. And the reason for that is we need to be able to see these polyps that, like I mentioned, are millimeters in size. Now, the scope itself magnifies things, but still, we have to be very careful to see the entire circumference of the colon, and it can be up to 6 feet long. So we have to be sure that it's a clear picture. So how do we get that to happen? Well, you're going to be on a clear liquid diet the entire day before, no solid food. And then usually in the afternoon, you start drinking this medication that we call the PrEP. And what is that? Is basically a high-powered laxative that's going to make you run back and forth to the bathroom pretty much all afternoon and evening until there's nothing really but water coming out. And that's how we know that you're ready to go, that you're prepared. And so once that's done, the day of the procedure, you come to the facility. It's usually either done at an outpatient surgery facility or a hospital. And you'll have an IV put into your arm by one of the preoperative nurses. And then there's usually an anesthesiologist present who will administer the sedation, which gets you off to sleep very quickly. And we do the exam while you're asleep. You're not going to feel anything. You're not going to be aware of anything. And it takes about 20 to 30 minutes, depending on if we find any polyps, if there are several that we have to remove. And then you'll wake up in the recovery room. And oftentimes patients tell me that it's the best sleep they've ever had. They wish it could take longer. And you might feel a little bloated. You might have some gas to pass, and that's okay. But generally speaking, it's a very well-tolerated exam. And you usually get you out in time for lunch.
Yes. And actually, the lunch is really great when you're hungry because you haven't eaten and you've emptied out your entire, 6-foot colon. I know it's not an easy procedure in terms of an easy prep, let's say, Dr. Joseph, but I think it's just so worth it. For me, they found 2 polyps. Luckily for me, they were benign, but it was good for me. It was a learning curve for me that, hey, who knows what could have happened? I checked off that box because unfortunately, there are some people, Dr. Joseph, that hear the news that they have cancer. So once they get that news, what are the next steps after that?
Sure. So that's never an easy news to get. So make an appointment with a medical oncologist, and I can kind of run through what we do here at Miami Cancer Institute. So we have specialized oncologists like myself that do gastrointestinal cancer. So for example, colorectal cancers. Myself, and then I have 3 other colleagues that also work alongside with me. What's neat with us is that we do a multidisciplinary approach. So we have nurse navigators, we have nurse practitioners, we have physician assistants, we have pharmacy. We kind of have everybody here with you because not only do you kind of become part of the family, because it's not easy with this diagnosis. So we try to make coming in to the Cancer Institute as easy and as informative as it can be. So the first thing that we do during the appointment is we review the pathology. So during the colonoscopy, we get the pathology and we see what needs to get done. So we have a diagnosis of colorectal cancer. And the first most important thing is to stage the patient. And what do I mean by that? What we do is we take full body pictures of the chest, of the abdomen, of the pelvis. We generally do plain CT scans, and we look to see if the cancer has spread to anywhere else in the body. If it's localized within the colon, then we always refer to have surgery. So that is the standard of care, is to have the colorectal cancer removed surgically. After that, we look at the surgical pathology to see if there's a need for any chemotherapy, for example. And that there's a lot of factors, a lot of different things that we do look at the surgical pathology to see if you would benefit of a short amount of chemotherapy. Sometimes it's 3 months, sometimes it's 6 months. It really depends on if there's lymph nodes involved, if we have high-risk features such as obstruction. So we kind of go through everything with you guys. So once that has been decided, at that point, we can discuss surgery. I'll see them after the surgery, after they're done healing. So that's one part. If the staging scans come back positive for that the cancer has moved to different parts of the body, there's something neat about colorectal cancers, that one of these cancers that when you hear the term stage 4 cancer, we kind of think, this is non-curable, it's all palliative in nature. But I've had personal patients with a stage 4 diagnosis of colon cancer cured. So at the time of the diagnosis, he had disease in the lung, disease in the liver. We resected, we treated with chemotherapy, with radiation, kind of like a sandwich approach. So even though patients are sometimes diagnosed with stage 4 cancer, there still is hope and a chance to cure them of the disease, such as we cure them with an earlier stage, for example.
And there's always that hope at Miami Cancer Institute for sure, Doctor. Dr. Moseson, let me ask you something. When you are done with the procedure, for example, and you see the polyps, for example, when my doctor told me I found 2, obviously I got really nervous. I had to wait for the results. How do you tell that patient so that they calm down, wait for the results? Because at that moment, you want to hear there's nothing.
Right. You don't want your doctor to come out and tell you that you have multiple polyps, but sometimes it happens. And typically we can tell sometimes just based off of their appearance during the colonoscopy that they're probably benign. The majority of polyps that we remove are actually benign. And if you think about it, this is the reason that we're doing this exam in the first place, is to find these polyps before they become a bigger problem or they turn into cancer. So I typically tell patients, listen, you had some polyps, they're most likely benign. It'll take a couple of days before we get the official pathology results back, but I will call you as soon as I get them, and then we will go from there.
And that's exactly what my doctor told me. He said, you know what, you got a couple. I don't see anything to worry about. Let's wait, but they look benign to me. So thank you, because I wanted to reassure patients that just because you find a couple doesn't mean anything, or just because you find a few, they could be benign and you're good to go. So before we end this fabulous conversation, I have a couple of questions from our viewers, but I do want to set the record straight. What is the age today that is recommended for a colonoscopy? Dr. Joseph, take that one for me.
Sure, not a problem. So with, us diagnosing cancers at an earlier age, the screening recommendations has changed. So it used to be 50. Now we start at age 45.
Perfect. 45 years old. And here's a couple questions from our viewers. So I'm going to give one to both of you. Dr. Moseson, this person says, undergoing any procedure can take a toll. What is the recovery process like after a colonoscopy? You touched upon it. Just give us a couple sound bites. Pretty easy.
Yeah, so the anesthesia that they use is very quick on, quick off. Once it really passes through the brain and is out of your system, you really have very little hangover effects from the anesthesia. As far as from the actual colonoscopy, we use some gas to expand the colon so we can see what we're looking for. And that can give you kind of a bloated feeling afterwards. But like I said, that usually passes pretty quickly. And patients are eating and drinking before they even leave the recovery room most time. And the next day, they're essentially back to normal.
Fantastic. And Dr. Joseph, you touched upon this also at the beginning, but we always have viewers coming in and out. So I want to talk about the early signs and symptoms again for people to look out for if they should get one maybe earlier than that 45.
Sure. So earlier signs of colon cancer, there really are no signs. Sometimes they're asymptomatic. So that's why you always recommend to start getting your screening colonoscopies at age 45. If you do go to your primary care physician and you're found to have, for example, iron deficiency anemia, all the other labs are normal, you feel great, there's no other reason for you to be anemic, that's also a sign for you to say, hey, you know what, I need a colonoscopy. If you do have symptoms from the actual tumor causing maybe, for example, abdominal pain, so that would be one sign. A change in bowel habits tends to be the more common signs that we do find. So for example, if your stools were a certain caliber and all of a sudden they're thinner, they're looser, they're just different than what you're used to. And if that's associated with any rectal bleeding, so that's really darker. So your stools change in consistency and change in color. So those are the main signs and symptoms.
And then, of course, we talked about family history, obesity, probably smoking, and things like that as well.
So risk factors, correct. So it's always good to know, just ask. I know it's kind of not taboo to talk about cancer, but a lot of families sometimes don't mention it. So just say, hey, any family history that's pertinent for cancer, it's always good to know that. And when they did look as to why patients are being diagnosed at an earlier age group, hyperlipidemia, obesity, and alcohol consumption were also the top risk factors.
Fantastic. We have a couple minutes left. I always like to end with final thoughts. So Dr. Moseson, I'm going to start with you. Final thoughts for our viewers.
Colon cancer is preventable and curable, but it's something that nobody should have to go through. And the best way to avoid that is to get screened. So even if you're feeling perfectly well at age 45, you might want to make an appointment to come and see me and get it taken care of.
Fantastic. Thank you so much. And Dr. Joseph?
So I'm going to second that 1,000%. Colorectal cancer is one of these cancers that we can catch early. And if we catch it early, it's curative. There are a select few cases that, stage 4, it is advanced, that are curable, but those are very few and far in between. So I will always say, get screened, but seriously. So it's always one of those things that, we have these preventative measures. We've decreased the age for colonoscopies to age 45. If you do get diagnosed with colorectal cancer at the Miami Cancer Institute, we have a whole slew of a team. It's multidisciplinary, so we do treat patients like family. And as much as I don't want to have patients diagnosed with cancer, we're always here and we're always willing to treat patients like family once you do get diagnosed.
And as I'm being wrapped, I got a great question from a friend of mine, and I really want to get it in, and I think it's fabulous. And I'm going to have Dr. Moseson respond. A lot of commercials you see basically touting other tests and other procedures that are a little bit easier. You say,
in the right patient, those can be used. You're talking about like Cologuard or some of the stool tests that are available. Those are great at detecting late stage polyps and cancers. They miss most of the small polyps, and they're really only for your average risk person who's got no family history, who's never had a polyp before. And if it's positive, guess what? You still have to have a colonoscopy. So there you go.
So get your colonoscopy. Thank you so much to both of you. I appreciate so much your time.
My pleasure. Thank you.
Thank you so much.
And a reminder to our viewers, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. You can also connect with us on our social media channels. We've got them all: Facebook, Instagram, Twitter, TikTok, and LinkedIn. And check out our resource blog for the latest news at baptisthealth.net/news. You'll find a link there to all the episodes of Baptist Health Talk podcast as well. On behalf of everyone at Baptist Health, stay safe, stay healthy. Thanks for watching, and get your colonoscopy. Take care.